We break down the major body regions into two groups, and we have subgroups in those, axial and appendicular. Axial is going to be these two groups make up the major body regions. Axial are what you're going to see in purple in the skeleton, and that's going to be the head and what we call the trunk, and that's going to be where your heart and your intestines and everything lives. If you think about it, the axial areas are everything you really need to stay alive. The appendicular regions, if they were removed for whatever reason, you could still be alive, but without something in the axial region, it's going to be tough. If we look at the axial divisions, it's again the head, the neck, and what we call the trunk or the abdominal regions. They can be divided into 4 quadrants, and and those quadrants can even get broken down as well. And the reason we have to break these down is because when you're talking to a patient, they're going to talk about pains in certain areas, and it'll feel like the pain is coming from one area and they're going to take a leap. But really, we have to look at the body and see what's actually happening in that quadrant. Because, for instance, let's say you really ate a spicy meal, you might run to the ER and point to, let's say, a aching or burning near the heart. And what they know is happening in that region is you do have the heart, but what runs right next to the heart is the esophagus. And they'll know that, you know what, because it's in that region, a possibility could be that stomach acid is actually going up the esophagus, and that's what's causing that pain. So it really helps them with diagnosis. And you'll hear patients talk about pains in certain regions, and what's going to happen when you're done with anatomy 1 and anatomy 2 and starting in your nursing, when they point to that region, mentally what you're going to be doing is looking at that region and saying, okay, what is in that region in the average person, and what could the problem be? And so you're already starting to break down and make hypotheses based off of these regions. And when you start talking to your peers in the hospital, they're going to know the same region names. So you have to know the difference between left and right and which are these region names, because you don't want to look like an idiot when you talk to them. So if we look at the main ways that we could break down the quadrants, there's left and right upper quadrants and left and right lower quadrants, and we could break those down into 9 other quadrants. Now, something that you have to realize is that left and right, when we talk about left and right in a patient, it's the patient's left and the patient's right. So get used to talking about, when you see the patient, that they're left and they're right, not your left and your right. Because clearly, if you said to amputate the right arm, but you really meant left arm, when the person comes out of surgery, they're going to be really upset. And I wish I could tell you this doesn't happen and it's comical, but it actually does. If we went ahead and broke down the trunk into the 9 regions that we have, you'll notice that, number 1, I put 2 pictures here. One to show you each of the regions, and one to show you what are in those regions. So when people point and say, I have a pain here, here, or here, you can know, well, this is a little bit of where the stomach is, or this is where the small intestines are, or the pancreas is there. So this will give you an idea of what's happening in that spot, and it'll really let you diagnose a patient very quickly. So let's go through the regions. Right hypochondrial region, that's going to be right over here. Of course, there's going to be the left hypochondriac region. The epigastric region, this is called the epigastric region because if you look here, you'll see that there's a little bit of the stomach. See how much of the stomach is there? There's a lot of the liver right there, and gastric means stomach. If we go to the right lumbar region, that's over here, you could see that there's a little bit of the large intestine, a little bit of the small intestine still there. The umbilic region, that's going to be mostly small intestine. Left lumbar region. That's going to be a little more of the large intestine. So we'll break down the different parts of the large intestine into two and what all these parts are. Right iliac region. Later this semester we'll see the iliac and where those bones are, and you're going to find that there's a vein down here called the iliac, and that's going to go into the pelvis, so iliac region, right. In the middle is going to be the pubic region or hypogastric region. Hypogastric region is basically where you're going to see the colon, you're going to see the anus, you're going to see some of the large intestines sort of still in that area, and small intestine, and then the left iliac region. So by somebody saying, hey, I'm having a problem right over here, you'll kind of be able to isolate, well, it could be the sigmoidal colon, which we'll learn more about in 202, large intestines, or things like that. Body cavities are membranes, and there's different positions to them. Dorsal cavity is going to be the dorsal means top. If you think about a dorsal just means top. So dorsal is going to be like in a well, never mind. It's gonna consist of two things: the cranial cavity, which is the brain, and the spinal cord, the ventral cavity. If we move lower to the ventral cavity is going to be broken down into the thoracic cavity. Thoracic is going to be referring to the upper area above the diaphragm. If you feel on your body where your ribs sort of end, you're below your heart, and that's where your diaphragm is. So anything above that is going to be your heart and your lungs, and a little bit of your esophagus is going to go through that area too. Abdominal pelvis cavity, that's going to be below the diaphragm. So that's going to be the digestive organs, the spleen, the kidney, the pancreas, gallbladder. And then finally, we have the pelvic cavity. That's going to be the lower extreme. That's going to be kind of around your belly button or below. Bladder, rectum, reproductive organs, and small and large intestines. Here's a great way where you can kind of break down what's in what. I know some people are visual learners like I am. So you could see that the thoracic cavity and the abdominal cavity are separated by the diaphragm, and you could see a couple of things that are in there. The pleura means lungs, so the pleural cavity or lungs cavity. Pericardial, cardia or cardiac means heart, so pericardiac, heart cavity. The abdominal cavity is going to be where the digestive organs are, so that's going to be below the diaphragm. And then, of course, the pelvic cavity, where the reproductive organelles, anus, and things like that are. If we look at the dorsal cavity, that's going to be the head and above, so the head, neck area, and you can see that region too. Inside these areas, we're going to have this thing called a serous membrane, and it exists in the axial body cavities and surround the organs to reduce friction. So if you think about things in your car, like pistons and things like that, they put a whole bunch of oil around it, and they do that to reduce friction. They do that in our body too. So we do this so when organs touch something hard, they don't get hurt. We also do it so, like for instance, your heart. Your heart is in this thing that's like a bag, and can you see that fist? It's kind of like your heart. That balloon would be like the area that your heart is in, and it's filled with this liquid, and it's designed to basically make it so there's less friction on there, and it protects the heart, of course. Visceral serous membrane touches the organ, so it's going to be a thin film, sort of like a thin, almost like a skin that touches the organ. And the parietal membrane is going to line the body cavity. So that's going to be right on the ribs itself. So you almost have a balloon that touches, or a thin layer that touches the lungs itself, and then you have some that touches the ribs, and inside there's going to be a serous fluid, and that fluid is going to make it so your lungs can open and close without any problems, or your heart too. So you could see the one that I've put here for you is the heart. There's the heart, and you could see that the outer part is called the parietal peritoneum. You don't need to know that for this semester. You need to know it for 202. But you could see that there's going to be a thin skin layer on the organ itself, and there's going to be a thin layer on the outside, and inside there's going to be a fluid. The appendicular one I'll actually do in my next video.